How does Senate Bill 946 affect individuals with autism in California? Senate Bill 946, passed by the State Assembly and the State Senate on September 9, 2011, and signed by then Governor Brown and filed with the Secretary of State on October 9, 2011, is a monumental step for individuals with autism and pervasive developmental disorder in California. The new law took effect on July 1, 2012. Before this bill signing, individuals with autism could get necessary services in one of three ways. First, families or caregivers could pay out of pocket. Only a small segment of the population could afford this, as estimated costs. Monthly services ranged from $3,000 to $12,000. The second way to get services was to request them from your local school district. This has proven to be very challenging, as the school districts have been unfamiliar with the unique service type and more recently are financially challenged. Last was the option of regional centers. There are 21 in the state of California at present, and each one has taken a slightly different approach to providing services for individuals with autism and pervasive developmental disorder. In addition, the budget crisis in California in the early 2010s has greatly affected most regional centers' abilities to provide services. Thus, using a regional center then for services for an individual with autism or PDD, depending on where one lived and the policies of that regional center, could also prove challenging. As a result of SB 946 over the last few years, individuals with pervasive developmental disorders or autism are entitled to use their medical insurance to obtain services. Specifically, as of July 1, 2012, individuals in the state of California can now use their medical insurance to obtain services pervasive developmental disorders or autism. This applies to the following medical service providers: every healthcare service plan contract that provides hospital, medical, or surgical coverage. It appears that SB 946 does not apply to a medical insurance plan that does not provide behavioral health or mental health services, a healthcare service plan in the medical program, a healthcare service plan in the Healthy Families program. What treatments are covered? The following is what SB 946 is referring to when it is talking about services, specifically behavioral health, treatment needs professional services and treatment programs, including applied behavior analysis and evidence-based behavior intervention programs other than applied behavior analysis. No specific mention of another treatment approach is made. What is required of the treatment programs? The treatment programs must include all the following criteria to be eligible for coverage. First, the treatment must be prescribed by a physician or licensed psychologist. Second, the treatment follows a treatment plan developed by a qualified autism service provider and administered by a qualified autism service provider, qualified autism service professional, supervised and employed by the qualified autism service provider, or a qualified autism service paraprofessional supervised and employed by a qualified autism service provider. Third, the plan developed by a qualified autism service provider has measurable goals that are specified to a timeline and that are unique to the individual being treated. The treatment plan has to be reviewed no less than once every 6 months, modified when appropriate, and describes the individual with autism's impairments that will be treated, develops an intervention plan that specifies the service type, example, techniques, and methodology, the number of hours required, the level of parent participation to achieve those goals, and the frequency of progress evaluation and progress reporting. Fourth, discontinues intensive intervention services when goals have been achieved or are no longer appropriate. Last, the treatment is not used as a means of or a reimbursement for a respite program, daycare, or educational services, and cannot be used to reimburse a parent for participating in the program. What is a qualified autism service professional? SB 946 specifies the following criteria must be met to be considered a qualified autism service professional. First, the person provides behavioral health treatment, for example, treatment for individuals with autism. Second, if the person does not meet the criteria to be a qualified autism provider, The person is employed and supervised by a qualified autism service provider, for example, an agency or clinic. Third, the individual provides treatment that follows a treatment plan developed and approved by the qualified autism service provider. Fourth, the person is a behavioral service provider approved as a vendor by a California regional center to provide services as BCBAD, BCBA, BCABA, a behavior management assistant, a behavior management consultant, or a behavior management program as defined in Section 54.342 of Title 17 of the California Code of Regulations. We interpret this to mean that one of the criteria to be considered a qualified autism professional is to have met the vendor requirements of a California regional center. Fifth, the individual has training and experience in providing services for pervasive developmental disorder or autism. SB 946 also provided for an Autism Advisory Task Force. The purpose of the task force was to submit a report to the governor and specified members of the legislature by December 31, 2012. The report developed recommendations regarding behavioral health treatment that is medically necessary for the treatment of individuals with autism or pervasive developmental disorder. Send us an email at info@leafwingcenter.org if you would like additional information.